Well, if you made it this far, then this year wasn't as bad as we imagined it to be. When we look back at 2020, it truly has been an year of reckoning for the whole healthcare industry. Never before, since the AIDS crisis, has so much airtime been dedicated to medical news and updates. For the first time, the daily COVID update by ICMR and the Ministry of Health and Family Welfare had a higher TRP rating than a cricket match. Despite the doom and gloom, all around, people found interesting ways of celebrating. And the boring perspective of telecommuting became the hip new working from home. As we reach the end of the year, let's take a look at the events that defined healthcare, and let's also explore what 2021 holds for us. Hello, and welcome to Global Healthcare Archives by Medvarsity. The year 2020 will have the dubious distinction of going down in history as the year we lost, or annus horribilis, which translated literally means the horrible year. But was it really the year we lost, or was it the year that gave us a new perception of all things? After all, the discovery of an opportunity is a matter of perception. Although the year started normally enough, despite China reporting a mysterious pneumonia of unknown origin, the scenario globally was one of overall positivity. The disease was written off as an exotic disease of an exotic nation. In India, although the GDP was decreasing, the health industry was showing a steady growth. The picture became a lot darker when Italy reported its first COVID case on the 21st of February. The disease now seemed more real, having infiltrated the sanitized environment of the EU. With its steady and rapid spread globally, the World Health Organization finally declared it a global pandemic on March 11, 2020. This marked the start of the COVID crisis, which collapsed the already overburdened health ecosystem of several countries. The inadequate information available about the virus led to widespread panic, and confusion regarding its pathogenesis led to a series of trial and error for treatment, such as the antimalarial drug hydroxychloroquine and plasma therapy with varying results. A fortunate side effect, of course, of this panic, however, was a real democratization of healthcare. The use of mechanical ventilator, till then considered to be an exclusive purview of anesthetists and intensivists, became a skill required by every healthcare professional. Several healthcare startups such as Noccarc Robotics, AgVa, and Biodesign made headways into manufacturing effective and low-cost ventilators. Furthermore, corporate giants such as General Electric and Tesla attempt to manufacture ventilators, opening the door for further manufacturers to come in the future. The production of low-cost ventilators and the availability of open-source 3D printing sets the stage for similar innovations in other vital medical equipment, painting a promising future for the ubiquity of healthcare. Another outcome of the COVID-19 pandemic is the increased digitization of healthcare. In-person consultation has decreased by 67%, whereas teleconsulting has increased, with the average 15 to 20% of the healthcare ecosystem expected to shift to virtual care across triaging, consults, remote monitoring, and home health. The use of AI and ML for diagnosis as well as treatment of disease is increasing. Furthermore, big data is increasingly used in healthcare industry for the collection and collation of data to define future healthcare trends. This allows us to be better prepared for future emergencies. This year has had major health consequences as far as mental health is considered. The lockdown and the resultant self-imposed isolation led to multiple psychiatric problems, leading to an increase in the rate of suicide and domestic abuse. Whereas the financial turmoil and increase in layoffs led to an increase in the cases of clinical depression. At the same time, healthcare professionals too were dealing with their own mental health challenges. The pressure of being exposed to the virus every day and the potential of taking it back home to their loved ones was very real, with many professionals reporting symptoms of PTSD. Healthcare workers also faced ostracization from society and physical and mental abuse. This in fact led to the amendment of the Epidemic Act of India on 22nd of April 2020, which made acts of violence against healthcare professionals a cognizable offense. The sheer magnitude of the disease initiated a race among pharma companies to discover a vaccine. Many national companies such as Bharat Biotech and Aurobindo Pharma and international giants such as Pfizer, AstraZeneca and Moderna competed to find a vaccine, of whom Pfizer and Moderna have emerged as winners. The year 2020 saw a dawn of superheroes who donned PPE kits and hazmat suits instead of capes. Several healthcare professionals laid down their lives while combating the virus and treating patients. Nurses emerged as the steadfast, albeit unsung heroes of the COVID crisis. Be it the heart-wrenching pictures of nurses with mask lines etched on their faces due to the long duty hours, or the story of Reshma Mohandas, who helped two of India's oldest COVID patients recover, contract COVID herself, and went back to work after recovering. They were the face of bravery and hope in an otherwise dismal environment. Dr. Harshvardhan, Dr. Randeep Guleria, Dr. Balram Bhargav, and others who led the COVID fight at a national level. Dr. Anthony Fauci, Tal Zaks, Ugur Sahin, and Özlem Türeci, the couple behind Pfizer's vaccine, became the poster children of a COVID-free world. Well, with the year behind us, let's look at what 2021 has in store for us. While specific sectors like hospitality, travel, and entertainment will take years to recover, the pace of innovation in healthcare has definitely accelerated. This crisis has also woken up many governments across the world who are now realizing the significance of a robust public health system and are also focusing on strengthening the same. This includes preventive aspects and disease surveillance mechanisms. The Government of India has also been increasing its health expenditure and is expected to spend about 3% of GDP on health by 2022, increasing from the current 1.28% of GDP. These investments in healthcare are being used to enhance the training and recruitment of healthcare professionals like nurses, respiratory therapists, intensive care specialists, and ICU nursing. With the subsequent peak of COVID cases in summer and winter this year, the world has also taken cognizance of the gaps in infrastructure, which is essential for the delivery of an appropriate care like sample transportation or test kit availability or even vaccine delivery and the whole transportation infrastructure required to manage the same. This is causing a positive ripple effect on other industries beyond core healthcare. For example, in the start of March this year, India was importing PPEs. But soon after, India increased the manufacturing of PPEs domestically to become the second largest exporter of PPEs in the world. The other big beneficiary of this crisis has, of course, been digital health. The sudden drop in hospital footfalls led to a rapid adoption of teleconsulting and remote care management. Wearables have become more relevant now than they were ever in the past. From tracking our fitness goals while we were locked at home to predicting adverse health effects and also keeping us safe. Apple's iWatch, for example, can now diagnose cardiac issues and can also alert emergency services in case of a fall. Artificial intelligence is breaking boundaries and is now playing a more important role, right from helping doctors to read X-rays and CT scans to helping in predicting the trajectory of any health condition. We're making strong strides on the technology frontier, but we're still at the initial stages of a utopian, equitable world. The silver lining, of course, is that we have shown how collaboration between unrelated people and industries can become a savior in this crisis. This gives us hope that when humanity is up against a wall, we can all come together and get over the crisis. As we look at the year ahead, let's keep a few things in mind. Remember the first thing we do every year during this time? Yes, the New Year resolution. Well, forget that and let's get real. For you and me and everyone who's remotely connected to healthcare, 2021 is likely to be a bigger year than ever before. Innovation in all forms, devices, services, technology, and also people is going to be central to our success. But linked to that is collaboration. The world is definitely smaller today than it was at the starting of this year, and it's only going to get smaller. We, all of us, have to connect, collaborate, and create together. It's obvious that healthcare education globally needs to evolve, and skills that were long forgotten needs to be relearned. As we wrap up this year's last episode and look forward at what's left of this year, I would like to wish you and all your loved ones a very happy new year. I and the rest of the Medvarsity team will be back next week with a brand new episode of Global Healthcare Archives.